Methodist Hospital in Fort Bend recently held a seminar and heart health fair to help people in the community get a better pulse on why heart health should be an important part of your daily life. A representative from Methodist explains more about the event.
Today we have heart screenings along with lung screening information, mammography screening, scheduling, varicose vein information, and patients can actually talk with physicians about some of their results. We also have a seminar going on with Dr. Passmore and Dr. Mangan speaking to patients. First step to heart health, because they're learning key figures in that with your blood pressure and your sugars. They'll also be learning from some of the cardiologists that are here tonight, some different risk factors for them so that they can put an extra focus towards that. Maybe they need to go see their primary care physician a little bit more than they have been, so it helps them take that first step towards being heart healthy. I believe the heart seminar can help save lives because there might be some patients sitting in there that, one, don't know what the risk factors are. Maybe they've never had their blood pressure checked or haven't had it checked in a while. So I feel by coming here tonight, they learned those things. You never know, something might happen tomorrow, or they might find out a risk factor and be able to decrease that risk factor by eating healthier and lowering their blood pressure and their sugars.
We also spoke to some specialists in the field of cardiology at Methodist to get more information on heart health.
The majority of people actually are unaware of their cholesterol or blood pressure problems, and this will be an ideal opportunity for them, if they're not aware, to be alerted to the problem that they may have. Blood pressure is classically described as two readings, a systolic reading and a diastolic reading. So the systolic reading is the highest number. So commonly people look at blood pressure readings like an example is 120 over 80. The systolic reading is the blood pressure when the heart contracts, and the diastolic reading is the blood pressure when the heart relaxes. The normal range, the ideal number is approximately 120 over 70. Those patients that are treated, we like to keep the number at least below 130 over 80.
It's important because we know that if you can control all the variables that lead to a heart attack, that you can have a lower likelihood of progressing to having vascular events such as heart attack and stroke. If the blood pressure and cholesterol are better controlled, along with diabetes and not smoking, we can prevent some of those problems from occurring. Hopefully it'll make them more aware of what they need to do to be an active participant in their health care, by eating better, by not smoking, by helping to take their medications for both blood pressure and, if they have diabetes, medicines for that as well. The best thing that patients can do is to be an active participant in taking care of themselves.
The Houston Methodist Sugar Land Hospital is a very big community advocate and health advocate. We have, of course, we're expanding. We're adding another tower to our already existing hospital, and it is really an excellent place for patients to be able to come for their education at these seminars and the screenings, but also to know that we're here for them if they ever are having an incident at home. It benefits Fort Bend in particular because we are a large hospital, one of the largest hospitals that's in Fort Bend. We have the capabilities to treat the patients when they are having those heart problems.
For more information on keeping heart healthy, point your browsers to www.houstonmethodist.org. For Healthwise, I'm Cary Gordon.